Welcome to this trauma-informed bedtime hip flexibility. Let's move through some stretches for the hips before you fall asleep. I invite you to start with me in bound angle with your feet together, your knees out wide. You can place your hands on your feet or out on the bed, wherever's comfy. And maybe you wiggle your legs a little bit, shaking them like butterfly wings. Maybe you're craving some stillness and you just sit nicely, tuning into your breath. Or maybe you place your arms on your knees or on your legs, gently lean forward and push down, stretching out those hips a little more. Find the version that feels good for you today. You feel like those hips have stretched a little bit. I invite you to sit up nice and tall and just do little circles with the body as your legs are like this, grounding one way and then the other way. And I'll be moving into a pigeon shape here, so you can join me on your hands and knees on the bed. And then for pigeon, you're going to take your left leg, bring it up so that your left knee is behind your left foot. Back leg can be a little bit bent, a little bit straight, whatever feels good. And then you can rest on your forearms. You could grab a pillow. You could rest on a pillow. You could rest on your fists. Whatever works. And just take a moment to sink into the stretch. Maybe noticing tension in that left hip or the front of the right leg. And if you're able to, you might try and sink a little further and relax those muscles. Breathing here, let go of that jaw. Release any tension in the face. Taking one more nice breath. When you're ready, switching sides here, that right leg is going to go behind the right hand. So that right knee is behind the right hand, the right foot is by the left hand or somewhere in this general area. And then once again, you could stay up on your hands or you might want to sink onto your forearms or grab a pillow. Let your body rest into the bed, into the comfort, into the cushion. Just as with the other side, you might see if you can let go of those muscles, sink a little further. Taking one more breath. Slowly making your way back up and moving onto your back. Get nice and cozy on the bed here. Once you're on your back, you can have the knees bent and your feet on the bed. Take your right foot and place it on your left leg just above your knee. If that feels too hard to do, you could straighten the left leg and have the right leg resting with that other leg straight. If this feels good, you could push a little bit down on that right knee. Or if you want even more of a stretch, you can bring that left leg up and grasp behind it. Getting a stretch through that right hip. Choose the version for your body. Maybe you roll the ankles a little bit, or at least the bottom ankle, get some movement there. When you're ready, lowering that left leg down if it's up, taking that right foot off of the left leg, switching sides. So now that left foot's going to go on the right leg. You can have that right leg straight or bent. And then you might decide to lift that right leg up into figure four, or you might decide to keep the leg down and maybe gently push on that left thigh there to get a different stretch for the hips. Sinking in here. One more breath. Exhale. If your right leg is up, bring it down. You can take that left foot and drop it. And this time we're going to bring the right knee up towards your chest. And then you're just going to bring that knee, imagining like it's going to reach your left shoulder. You're not going to be able to get it that high, but you're just going to twist a little bit over with that right leg. Maybe feeling a pull or a stretch through that right hip. And just one breath here. Exhale, let go. Repeating on the other side. Left leg is going to come up. And then you're going to bring it over to the opposite shoulder. It's not going to get there. We can try. We can imagine. And then once again, a little breath. And exhale out. Keeping the knees bent. Once again, the feet are down. Bridging here or pelvic tilt, so you can just gently tuck the tailbone under, or you can actually lift the hips up in the air to get a bit of a stretch through the front of the hips, through the thighs here. Just one breath here. Exhale, come on down. And lastly, take those knees, knock them together, and just wiggle those feet out a little bit so that your knees are together and the feet are wide. Just stretching out the hips in a different direction here. Taking a moment. If there's any final movements that would feel good for your hips, do those now. If not, you can rest in whatever way feels good for you. If you're a side sleeper, on your side, maybe go on your stomach, maybe you stay on your back. Taking a moment to sink into the surface. Let that bed support you. Take a nice deep breath in. Sigh it out. And you can rest here as long as you would like. Thank you so much for joining me. I hope you enjoyed it. I'll see you next time.